Every time I do a video in this series, I think of something to say in this first few seconds, like how we all are interested in a specialty and how we want to know. Let's scrap that. Obviously, you've seen the title. You want to be a psychiatrist in the UK. Now you're watching the video. Let's talk about it.
If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe.
Hi everyone, my name is Ibrahim. I'm one of the internal medicine trainee working in the NHS. So let's talk about psychiatry. So it's a fairly extensive branch of specialty or practice in the United Kingdom. And to be honest, I think that this video would be a bit longer than other videos. So I would highly suggest look at the description box. I've already divided into different chapters, so maybe you can just look into the chapters that you're really interested in. But overall, as all the other videos in this series covers, we'll talk about psychiatry training, the structure of the training, and more importantly, how an international medical graduate can become a psychiatrist in the UK, irrespective of their position in their country, and what are the pathways that will involve for them to bring their psychiatry dream in the United Kingdom. Let's start. Here we go. Specialty training and career in psychiatry in the United Kingdom. So obviously we first talk about what does the training involve and what the training does. The training in psychiatry in the United Kingdom overall actually makes you advanced psychiatrist in specific specialty. So it's unlike medicine where if you undergo say for example a group A specialty in medicine, you become a general medical specialist by default, aside from being a respiratory physician or renal medicine physician or a gastroenterologist. But it's not like that in psychiatry. You just don't become a general psychiatrist by default. So there are advanced psychiatry training, which are specific that you take after the core psychiatry. I know this sounds like already complicated, but just follow along and we'll discuss everything in detail. And also in this training psychiatry in the United Kingdom, there is a possibility of becoming dual specialty. So you can become two separate advanced specialists together if you choose to undertake that kind of a training pathway. So let's move on. Obviously, this is the bare bone structure of all the training in the United Kingdom. So obviously become a medical graduate, then do foundation training, then you core level training, and then you do advanced training. So that's the pathway for UK medical graduates by default, and that's what they do. But it's slightly different for international medical graduate. So they have to work towards getting GMC registration, maybe at this point after the medical graduate. Or GMC registration has different pathways. If you're confused about how to get GMC registration, we have made videos, we have made articles. Probably in this corner, you will see a video, how to work as a doctor in the UK, which involves explaining about how to get GMC registration. So it can involve taking PLAB or other postgraduate exams. So in psychiatry, it would be MRC Psych, so membership of Royal College of Psychiatrists. So you get GMC registration, and then to enter into core level training, you either have to go through foundation training if you're eligible to go through, or you have to undertake a non-training job which will award you a CREST form, so Certificate of Readiness to Enter Special Training. So once you get a CREST form, which is necessary to get into the core level training, in psychiatry, the training is basically uncoupled. That means just because you finished core level training does not automatically progress into advanced training. You have to complete the exam, which is MRC Psych, before you can proceed towards advanced training. And also there is special recruitment process, so specialty training recruitment process at the initial bit of core level training and also before advanced training. So that's what makes it an uncoupled training. So it's clear you have to prove that you have equivalence of, for international medical graduates, that you have equivalence of foundation training via a CREST form, and you have to go through core level training and advanced training. There are other pathways. Keep watching this video. I will explain other pockets of different entries into the training and what it results in the long run. So, but this is the structure. We will find ways to insert in it at various points depending on how experienced you are. So foundation training versus CREST. So this is a age-old question. Should I do foundation training, or should I go for a non-training, or should I do a standalone? Please watch this video by Dr. Ibrahim where she explains whether you need foundation training or what are the other pathways we can prove equivalence of foundation training to get into any type of core training, be it core psychiatry, GP training, internal medicine training, or core surgical training. Now, core psychiatry training, so it's by itself is a training. There is a training called core psychiatry training, which is 3 years. And it involves trainees to go around in 6 months block into different specialties related to psychiatry and basically progress and obviously complete their MRC Psych all parts. So there's 2 parts of MCQ, and the last part is a structural clinical exam. So you have to complete the MRC Psych during this core psychiatry training. So as I explained earlier, in psychiatry training pathway, it's an uncoupled pathway, but there is a special psychiatry branch who has their own separate run-through training, which starts from ST1 and will finish at ST6, which is child and adolescent psychiatry. So child and adolescent psychiatry, you can join at the very beginning instead of joining core psychiatry training if you are really interested in pursuing this. You will see a lot of people talk about CAMS. So CAMS stand for Child and Adolescent Mental Health Services. So definitely if you're interested in that, there is no point going through other bits and pieces. You can just join as a child and adolescent psychiatry training from ST1. But if you want to join a core psychiatry training and then decide to join child and adolescent psychiatry later on, you can do that as well. So that's open for you. So 3 years of core psychiatry training. And then we talk about the advanced psychiatry training. So I'm pretty sure you're interested to know what are the different branches of psychiatry that are being trained in the United Kingdom, right? So advanced training is basically in those separate branches. So there are 6 individual branches, and I think there is 7 dual branches. So those are established pathway. So you see, advanced training can also have a module of subspecialty in that training program. So advanced training will have 3 years. So if you get into any of this advanced training, which are 6 individual specialties that I said, general psychiatry, old age psychiatry, forensic psychiatry, child and adolescent psychiatry, psychiatry of learning disability, and medical psychotherapy. So you can, after completing the core level training, choose to join in any of these specialties starting from ST4. And during this specialty, you can choose to subspecialize in specific specialties as well. These 3 are the GMC endorsed subspecialty: addiction psychiatry, liaison psychiatry, and rehabilitation psychiatry. So which will involve within the 3 years, maybe 1 year spending as a senior psychiatry registrar in any of those specialties. So I think addiction psychiatry was previously called substance misuse psychiatry, but now it's called addiction psychiatry. There are other subspecialty branches, but which are not GMC endorsed, which you can choose to pursue as well. These are perinatal psychiatry, neuropsychiatry, eating disorder psychiatry, something like that. So, as I said, these 3 years may involve you just doing all of this, 2 years in general psychiatry and 1 year in liaison psychiatry. Then you become a general psychiatrist and liaison psychiatrist, because that will be a subspecialty. But if you do neuropsychiatry or eating disorder psychiatry, it will not be GMC endorsed, but obviously if that is your passion, you can pursue that and help to get job as a specialist or consultant in that kind of setting, which looks after eating disorder patients. Now, as I said earlier, about dual training. So what happens is dual training. So I briefly explained that there is a possibility of being a specialist in a couple of those major advanced training. So these dual trainings are already made. So you cannot mix and match. You cannot become a general psychiatry with and say, for example, child and adolescent psychiatry. So I don't think that works, because the mix are actually where the work area would fall together. There are 7 dual already established. So this dual can increase your training. Obviously, it may make you 4-year training or a 5-year training, depending on different duality or different pairs. So the pairs are, you can become a child and adolescent psychiatry with also specialist in medical psychotherapy, forensic with psychotherapy, forensic with child and adolescent, general adult with forensic, general adult with psychotherapy, learning disability and child and adolescent, which makes sense, and also general adult and old age psychiatry. So you see, these are the specific training posts are already made for this kind of dual specialty. To be honest, when I was looking at how many posts are available, out of all of this, I think the most available post, if you want to become a dual psychiatry, is general adult and old age psychiatry. The other posts like forensic and child and adolescent, not all of the deaneries will be able to provide you for training coupling those two together. So if you're really interested in dualing in any of those specialties, you may have to be really perfect fit for that role, because the number of training would be less, number of posts would be less, so you can face more competition if more people are interested in this. We'll talk about how many posts are available and how the competition is in the next following slides. So this is a very good visualization of the whole pathway. I think it's from a psychiatry silver guide or something like that, where basically they have, like, put together everything. So you do core psychiatry training, then there's the first recruitment, then the second recruitment, and during the core psychiatry you finish MR Psych, and the higher psychiatry training is a grid of all of this. So you can do general psychiatry. In the general psychiatry, you can choose to do addiction, liaison, or rehabilitation, and after that you get specialist registration. And you can see at the top, CAMS run through training, and at the bottom there is a specialist and associate SAS doctors, which we will discuss as well. So you see the basically 3 routes, isn't it? Yeah. Move on. How competitive? Here we are. So core psychiatry training in 2019, applications were 814 and 473 posts. Again, I want to tell you that applications does not mean that all those 814 people were only interested in core psychiatry. They may have applied for medicine, GP, pediatrics, or whichever specialty they fancied, and they also applied in psychiatry. So the competition ratio is not a proper indicator for how competitive it is, but it gives you an idea how many people are interested, at least in this specialty. So the 473 posts and 814 people applied, giving the competition ratio of less than 2. And in 2020, 895 people and 410 posts, 2.8. And in 2021, 1,500 people applied with the 500 posts, giving rise to the competition. So like all the other specialties in the world, definitely with, like, every year the competition is getting a bit harder. But to be honest, below 3, I would not put it as a very highly competitive specialty. It's still possible if you have a good portfolio, if you prepare well for the recruitment process. So the recruitment process in psychiatry training, it has an exam, which we will talk about. So if you do well in the exam, you secure a post in the training. Unlike internal medicine or core psychiatry training, where the recruitment process doesn't have an exam, rather an interview and a portfolio and everything. Now, how competitive is general psychiatry? So it's a bit different in psychiatry. As I said, the psychiatry recruitment happens across all 6 individual and 7 dual specialty. In 2019 and 2020, the recruitment happened separately. You could apply only 2 of them. You could apply in either general psychiatry or forensic psychiatry and hedge your bet wherever you get it. But in 2021, with COVID and all the other stuff happening, the recruitment actually all became together. And that's what you could choose, like say for example, with specialty, whether you like, when your preferences opened, you could choose whether you want to rank the general psychiatry post higher or the forensic psychiatry post higher or the dual ones higher. So it was a complete together process, and I think it's here to stay. Maybe next year that would be the recruitment process as well for higher advanced training, that they advertise all of them in one pack, and they give you the option to make your preferences, and based on your score of the recruitment process, you get the offer. But previously in 2019 and 20, the recruitment only happened in specific advanced training, and that's why you will see the applications and number of posts are small. So it was a good year for general psychiatry, right? Maybe like all 182 people actually got the post, because 184 posts were available. I'm not sure whether all of them accepted or not. Then we move on to 2020, same thing, 155. It was not that competitive. Now fast forward to 2021, last year, there was 453 applications. Mind you, this is not only general psychiatry, this is all advanced psychiatry, 6 and 7. So 6 single and 7 dual that we talked about. And the posts were 410. So to be honest, comparing with all the other specialties, psychiatry training or getting into a higher psychiatry training is not competitive. I mean, you can safely say that, yes, there will be people, but as I said, applications does not mean they all actually wanted to do psychiatry. Probably they did because it's an ST4, so yeah, scratch that. So maybe, yes, overall looking, the training is fairly easier and achievable to get into. Now, let's talk about payment. So, as I say in all other videos, as a trainee, you get paid. You don't have to pay your hospital or Royal College for the training they're providing. You are working as a doctor and you are getting paid as a doctor while you are doing the training program and working towards becoming a specialist doctor. So the pay depends on the level that you're working. This pay bracket that I'm going to mention here is for England only. They have a separate pay for the other devolved nation in the United Kingdom. So in England, as an ST1 and ST2, your basic pay without any on-calls or anything is this amount per year. From ST3 to ST5, the last year of core psychiatry training and the first 2 years of advanced training is this amount. And the last year of your advanced training would be this amount, £57,077 per year as a basic, and the consultant starting salary is this amount, which is the same for all specialties. And then once you progress in your career as a consultant, then there are other areas of clinical excellence awards which you get and progress, and that increases your salary. And also if you get involved in private work as a consultant, that also increases your salary, which is very variable, and it's beyond the scope of this video. But yes, there is possibility of getting involved in private work as a consultant when you finish your training program. Now, I think this is the most important bit of the video, and if you have skipped all other previous parts and just jumped into here, how to get a CCT as an IMG, let's start from the beginning. So obviously, you have to be a medical graduate, and then you have to work towards getting your full GMC registration. It could be PLAB, it could be any other exams you have to undertake in. If you're psychiatry oriented, then I would obviously suggest to complete MRC Psych. So you cannot get anywhere with just one part or two part. To get GMC registration, you have to complete all parts of MRC Psych exams, all parts of PLAB exams, and only then you can get GMC registration. So once you get GMC registration, then your target is to join somewhere, work as a non-trainee doctor to gain some NHS experience, and also prepare your portfolio to apply for a training program. And at the same time, if you want to apply for core psychiatry training, you have to have a CREST form signed. So that gives you, this non-training job time gives you the expertise and at the same time orientation to the NHS work systems and how the whole thing works for you and whether you want to join psychiatry or not. So obviously during this time, if you can get a job in psychiatry as a non-trainee junior doctor or a senior house officer or clinical fellow, that would be useful, because then you'll understand how psychiatry works and whether you want to do it or not. If you decide you want to do it, then you apply for core psychiatry training. So core psychiatry training, we'll have a recruitment process, we'll have an exam which is called multi-specialty recruitment assessment, the same exam that you take for all the other specialties, a GP, like, you know, even for camps if you want to join. So I can't remember on the top of my head, but there's several specialties that takes this exam as a recruitment process. I think neurosurgery takes it as well. So radiology takes it. Okay, I'll stop remembering. So now we move on to core psychiatry training. So you get the recruitment process and you join core psychiatry training. And during the core psychiatry training, you complete MR Psych exams, and again, you go through another recruitment process. CASC is the final part of MR Psych. So based on that score, that gives you the chance to join the advanced psychiatry training. The training that we talked about, 6 single ones and 7 dual ones. And this is the pathway to obtain a CCT. So you have to do both core training and advanced training in the UK in order to be eligible for a certificate of completion of training. So you have to do both core and advanced in the UK, and that will get you CCT. But now, for the IMGs who are already done some psychiatry work or some psychiatry specialist training in their own country, so what for them, if they have done some training and they want to do the advanced training module in the UK, they can do that. So they can bypass the core psychiatry training by getting a core alternative competencies form signed. So it is possible for international doctors who have done psychiatry training elsewhere other than UK to actually bypass the core psychiatry level training by getting a form signed. So let's talk about how the pathway goes. So obviously, medical graduate and get GMC registered. If you want to do this, I would highly advise then come to the UK already MR Psych completed, because that will make your life so much easier. And I think that would be the best pathway. If you are in the middle of your psychiatry training in other country other than UK, then work towards getting an MR Psych completed. And while you're doing the training, you can either work towards getting the alternative competency signed there, or after completing MR Psych, when you come to the UK, you can start a non-training job as an SAS doctor or a specialty doctor, and then get a certificate C signed, which is the alternative core competencies for core psychiatry training. And after the certificate C and also MR Psych completed, you go through the same recruitment process where CASC score will be used to rank your how good of a trainee or how good of an applicant you are, and the join advanced psychiatry training, as I said earlier, the 6 single ones and 7 dual ones. So this is a pathway for someone as well if they don't want to do the whole core psychiatry and everything as well. But the catch here is you don't get a CCT, you get a combined program, CESR-CP. So it's to be honest, in practice, whatever advanced psychiatry training you do, you'd be a consultant in the specialty, but your consultant route is not CCT, your consultant route in CESR-CP, and there is no effect on your employability or your expertise in the United Kingdom. But if you want to go outside the United Kingdom, it may have an effect. I'm not sure about that, but I have heard that if you're not a CCT, a lot of other countries may not accept you as a specialist. So it's a may not, and a big may not. So yeah, but it's a possibility. If you want to stay in the UK, you can take this route by not doing core psychiatric training and working towards getting your certificate C, which is the core alternative competencies for core psychiatric training signed. Now, obviously, we've talked a lot about non-training training. If you have further questions, I don't understand this, what is non-training, what is training, please watch this video where I explain the differences and the core differences between a training and a non-training job. The link would be here somewhere here. Now there is another route where you can get a specialist registration without going through any training program. So this is called a CESR route, Certificate of Eligibility of Specialist Registration. So this application goes to GMC. So not necessarily that you have to pass all the exams of the UK path say for example MR Psych, but if you do, it's easier to prove that you are competent enough with the core knowledge of psychiatry. But if you have any similar exam that you had to pass in your country, say for example your country may have 5 years of or 4 years of psychiatry training, which made you a psychiatric consultant, and you were a practicing consultant in that country. Now you want to become a consultant via applying through CESR route. So there is a complete application process which GMC publishes their guideline. Even RC Psych, so Royal College of Psychiatrists, also has, they call it a CESR clinic session. So they basically organize this kind of educational session where they talk through what do you have to do to get a CESR application approved, because when you apply to GMC, they basically consult with Royal College of Psychiatrists whether the evidence that you have provided in your CESR application is enough to give you specialist registration in the United Kingdom. So MRSI could be one thing that you have to add skills and experience. You have to provide a lot of stuff about what you have done so far, what kind of cases you have seen, like, you know, the frequency of work that you have done, the caseload that you have managed. Teaching and appraisal, you have to prove that you provide regular teaching and your capability of appraise students and trainees, and courses, relevant courses to prove your competency. Audits and research, obviously involvement in audits and research will be paramount. And finally, the structured references. So there is references behind me, so you have to help provide references for yourself as well to provide to go into CESR route. So this is something very doable. It's not a lot of people think, oh my god, CESR is a huge mammoth task. It is basically you are proving that everything that you did as a non-training capacity is equal to training capacity. So it will not be an easy task, but it's not an impossible task. So if you want to work as an SAS doctor, a specialty doctor in like, you know, after completing MR Psych, say for example, you applied and got a specialty job in one hospital and you really like that hospital, and you know that if you apply for training, you may have to move to a different hospital, and you're like, I don't want to move. I want to work in this area. I really like the cases that I see or the locality and everything. So continue to work in that hospital as a specialty doctor and continue to collect your evidences, what you will use in a CESR application. It may take you 2 year, 3 year, 4 year, whatever year, and then apply for CESR, and that's the way you can get a specialist recognition without completely joining into the training program. If you're really interested to talk to us about how can you structure your specialty training pathway in the United Kingdom, we do offer personalized guidance session about specialty training in the United Kingdom. Head over to road2.uk/session, which will take you to this website, guidance.roaduk.com, where if you click look now, then you will find this guidance on specialty training pathway, where if you click learn more, it will take you to the booking page. When you click again, you can actually choose now which mentor you want to book it with. If you click on Breeze, then you will see the dates that she is available and choose the dates. You see different dates she might be available in different time according to your time zone. Similar for me, if you just tap on my photo, you can find the different times that you can book a personalized guidance session with us. There you have it, an overview of psychiatry training structure, pathways, and all the bits and pieces in the United Kingdom. If you have any questions, do ask in the comment below. And if you have any specialty in mind that you want us to cover, firstly, please do check the playlist, whether we have already covered it. If we haven't, do let us know in the comment below which specialty you want us to cover. We are trying to work through different specialties, and hopefully the next one would be your choice of specialty. If you haven't already, please subscribe to our YouTube channel and follow us on Instagram and Twitter, and like us on our Facebook page to get updated with everything that's happening in the United Kingdom regarding your medical career. And at the same time, we have an amazing newsletter that we send out every week with updates and the thoughts and all the things that's happening in our lives. It's called Weekly Updates. Be sure to check it out. And also we have an amazing forum for international medical graduates who wants to work in the United Kingdom, where you can ask questions, and there are ambassadors who are quite helpful. And if you are really looking for something that you cannot find anywhere, that might be the place that you can ask and get the answer from. Until then, thank you for watching this video again. Have a nice day.